The person must be actually doing everything and still not having the results. But diet only is not the way to lose weight. So bariatric surgery is given as a treatment solution for disease. So definitely it is good.
Welcome to PicPax Podcast. Today we have a respected guest, Dr. James Zackariah. He has over 35 years of experience as a general surgeon and also over 9 years of experience as a bariatric surgeon. This discussion is going to change your perspective about obesity because I have met one of the rare doctors who is interested genuinely in his patients. Welcome, Dr. James, to our podcast.
Thank you, Donna.
So, Doctor, I would like to start with you. What was behind your choice to be a surgeon, or what inspired you?
Actually, Donna, to tell you, there's a very interesting story because that's where it all started. I was probably 5 or 6 years old, toddler, and I had something that needed a shot, an injection. And I was so dreaded by that whole experience and how that injection hurt me. And I was angry with my doctor, and I decided that time that this is not how it should be done, and I will become a better person, a better doctor. So it looks funny, but that I remember was a seed that remained in me that kept me focused that I should take up medical profession. And after I took medical profession to become a surgeon, there were people who recognized my skill sets, which showed that I was good in dissection of whatever that came as a biology, and then later on in my anatomy dissection. So that's how I took up surgical profession. But in surgical profession, I think I must mention that there were great mentors in my life because of good institutions that I went to. Christian Medical College, Vellore, is known very much in India, one of the premier institutions, where it was not only about academic excellence, it was about being sensitive to the patients, to feel like the patient, to see the socio-economic background of the patient and tailor your care to their needs. So that was something that was very unique, and even today it's still unique in that way. And I'm grateful because at that moment it helped me to see every patient as a life, as a person like me who's going through their lives, and so to switch my positions with theirs and try to think like that. So this is something I think I gained from my mentors who modeled it for us, even surgeons who modeled it for us. But this is way back in between 1986 to 1990. So from that moment onwards, I'm operating nearly 35 years roughly. And I've seen how the doctor-patient relationship has changed so much. Because at that time there was no Google or ChatGPT and information. The patients who used to come, they used to come because doctors were revered that way. They trusted doctors, and doctors saying something, they followed it. The difference now is that everybody comes with a lot of questions and doubts, and they have fixed minds. Those days, they trusted us. So I find in my own practice, it was so easy to get good results that time and, give them the best because they would take it, believe it, and get the best out of it. There was no struggle or resistance. But in the last 10 years, I would say things have changed so much, and it is a challenge now to give the same kind of care because each patient comes with their own baggage, I would say, information baggage, so many voices, so much information, and they're constantly checking even outside the OPD, what is it that they used to ask the doctor. There's so many advisors. So what kept me focused is this, that think like how the patient is thinking and give him your personalized care to the patient. So this personalized care is something that I followed. At the same time, being professional, I had to keep myself updated. It doesn't mean because I can think like the patient, I can become a better doctor. It's a combination of thinking, personalized care, as well as being a well-read, well-informed doctor. So this has helped me to get exceptional patient outcomes and patient experiences. So that would summarize my journey as a surgeon, where it started and where is it now today.
So, Doctor, as you know, 2/3 of population in UAE suffering from obesity. So what is the main health issues related to obesity?
Obesity has been recognized to be a disease rather than just because of excessive eating. I would see it as under three headings. Obesity because of the heaviness of the body, because of changes in the metabolism in the body, and the other one is changes in the mind. So, though it affects every part of our body, obesity mainly is known to affect cardiovascular health. That is, it can cause blood pressure, it can cause heart disease, it can cause diabetes, it can cause increased cholesterol, it can cause, these are the metabolic things. Because of heaviness, there'll be tension in the abdomen, there is in the stomach. So there'll be changes that are going to happen because of that. Hiatal hernia, there is polycystic ovarian disease. Because of weight, even the knees get affected, can cause osteoarthritis. And more than that, we see obesity affects the mind. People get, the psychosocial changes that takes place in a person really is what that bothers them. And they become really patients suffering with this disease, and also decreases the quality of life and the longevity of life.
Okay, doctor. So I will continue also how obesity will affect the nutrient absorption in the body.
Yeah, actually obesity is a result of either, extra nutrition, but there is also undernutrition in obesity. Mm-hmm. The reason is because people who have obesity have got probably disproportionate attachment to certain kinds of foods. So they have more of them and neglect on the wholesome kind of food. So then, in other words, their nutrition is not balanced. Mm-hmm. That is one aspect. The other aspect is in obesity because of excess of fat tissue. The distribution of the vitamins and other important minerals is not even. So some of these adipose tissue hold on to these nutrients. And so the nutrient is actually, though it is available in one part of the body, is not available in the necessary parts of the body. So they have a kind of a deficiency. For example, vitamin D. It is very much attached to the fats. So it will not be available for the actual metabolism. They can have vitamin D deficiency because of obesity. So it can be a combination of overnutrition and undernutrition. In simple words, it is not a balanced way of going with their nutrients.
So, doctor, that leads me to another question. What is the relation between obesity and metabolic health?
The term metabolic health is something that is recent. Mm-hmm. In 1988, one doctor, Gerald Reven, he mentioned about association of obesity, that is increased waist length, blood pressure, high blood sugar, that is diabetes, and cholesterol. So these things come as a group and recognized and called it as metabolic syndrome. So he showed that they are not separate illnesses, they are all part of the same problem, which is metabolic ill health or metabolic disease. So this leads to a lot of fatal conditions like heart attack, diabetes, which can lead to vascular complications, that is, blindness, stroke, and so many other things. So that metabolic health is a result of the deposition of excess fat tissue in the body. So now doctors, especially specialists like endocrinologists in America, that is American Endocrinology Association, have identified it as a disease which is called as ABCD.
Okay.
Adiposity, that is fat tissue adiposity, based chronic disorders. Okay. So that is the term which is metabolic ill health, which actually has so many ramifications, which includes excessive fat tissue as obesity, high blood pressure, high blood sugar, high cholesterol, and waist circumference. So when all these things come together, we know a patient is having ABCD, that is adiposity-based chronic disorders, which is also metabolic syndrome. So obesity is very much linked with metabolic ill health.
Great.
Talking about metabolism, so important. Metabolism is actually the complex reactions that take place in the body, which is important to assimilate energy that we take in and the energy that we spend. Though it is not completely mathematical, that means, some people think you have more calories and then you work out calories. That's how the calorie calculation is a farce. It is not how it works. Because behind all these calories, there are a host of hormones inside our body which modulate this metabolism, which people are discovering still. That part is where all the activity is going on. So if the hormones are not doing its work, whatever goes in does not go out. So it accumulates. Do you know, interesting fact, If you are consuming, let's say, 2,500 calories, our body burns most of it. We need only less than 1,000. So in other words, just imagine 1,500 calories per day is extra in. So where does this go? Body just burns it off. If it doesn't burn out, and if there is some leftover, like you eat in a dish and you feel something is leftover, that leftover accumulates. First day, second day, third day, fourth day, like that. If you start calculating what all accumulates over a period of 20 years, you and I will fill this room. We'll be so fat.
Yeah.
So it shows how much the metabolism hormones are working to burn away our fat. So that is, so when any dysregulation happens there, it becomes metabolic ill health or metabolic syndrome. So when the energy is not used, it starts storing it into the tissues, fatty tissues. So fatty tissues become loaded with fat, which is nothing but stored energy. This stored energy, with the fat, each cell is, from small it becomes big. So that cell, the size is bigger than what it can manage. So circulation to these cells becomes less. So cells become sort of what you call ischemic or inflamed. So today they come up with this thing that obesity is nothing but inflammatory condition of the adipose tissue.
Yeah.
So that is why this adipose tissue or what we call fat tissue is not like normal fat tissue. They are diseased fat tissue and they are creating hormones. Adipose tissue hormones are called as adipokines. So adipokines are the ones that start blood pressure, cholesterol, fatty liver, and all the changes to make it diabetic. So you see one cause leading to so many illnesses, which we thought were separate illnesses. And doctors are there for diabetic specialists, are there, blood pressure specialists, heart specialists. So one patient has to go through all these separate specialists to treat his condition. He'll refer to. So what happens is, they don't realize that everything actually comes from the adipose tissue, which is why we say, you decrease your weight. Once you decrease your weight, all the other things starts. So bariatric surgery is what we offer for those people who are having this disease situation, where once the fat tissue is reduced, all the other organs, they come to a harmony and the metabolic health is normalized.
So, doctor, on a similar note, what are the dietary changes that you recommend for your patient who is struggling with obesity?
Any patient coming to me with obesity, I am not a nutritionist, but I assess their BMI. There's a level to which we can give dietary advice, beyond which even dietary advice will not help. But for those in general, whether you're higher level or lower level, the general principles are you take whole food, nutrient dense, low calorie, whole grains, healthy fats, fruits and vegetables. And beyond this is being mindful of what you're eating, to have a balanced diet. Most people can observe this for some time, but not all the time. So the secret is, along with the diet, is consistency or having a lifestyle change which can sustain as a part of their daily life. So those people are able to get better results than this pulse or periods of dieting and then not dieting. That creates more difficulties. So in short, we have found out that fruits and vegetables, whole foods, instead of simple carbohydrates, instead of refined sugars, instead of calorie dense, and fats also, there are healthy fats and non-healthy fats. So sticking to a balanced diet in this manner would be what I would advise.
So, doctor, about supplements, how it play a role in managing the obesity cases and also even overall nutrition health?
Normally, by now regulation, we are supposed to see every patient who comes to me for any surgery and things like that. We need to do a profiling of their baseline vitamins and then if there are serious deficiencies, to correct it. Because obesity itself can create deficiencies, as we discussed before, because of imbalance in their nutrition. But more so, the supplements are necessary in my practice for patients who have finished their bariatric surgery and they are having challenges of choosing the food because they can't eat much. So whatever little they are eating, they have to really choose and be intelligent about their choices of food. So the thing that we need to do is, instead of blindly taking vitamin supplements over the counter, it is always good that a person gets his profile, that is, vitamins. Very important vitamins are vitamin D, vitamin B1, B12, folic acid, and regular hemoglobin, iron. So there are some few tests which needs to be done for them to know what are the supplements required. So now, previously it was difficult. They had to go to hospital and get a doctor to see, examine, go through a consultation, and then get the prescription through insurance. But nowadays it's becoming easier. I believe that your company is doing something which is making it easy for patients to have their personalized investigations.
Yes, at PicPax, we believe in personalization. So that's why we offer this service, blood analysis checking.
Okay.
So patient just can order it. The DHA licensed nurse will visit there at their comfort from home, office, or anywhere they prefer. She will just collect the blood sample, and then they will receive the report along with the recommendation, and they can have also chat with the nutritionist, and they can have like dietary plan and everything personalized. So it's like personalized investigation and resulting in personalized supplement. Exactly. Recommended.
That's great.
Okay, doctor. So building on what you have just said, so what is the common misconceptions between obesity and diet?
Actually, there are many misconceptions because this has become a very troubling part of people's lives, obesity. So there are many people taking and bringing in a lot of designed misconceptions so that their businesses can flourish, whatever. But anyway, misconceptions are that they think that obesity is not a disease. They can just adjust their diet and obesity will become normalized. Or they think by extreme dieting, they can, control obesity. Now, these things are not true. We should accept obesity today because of scientific, evidences that obesity is a disease. It's a disease and a symptom of a deeper problem which we discussed before, a metabolic disorder. So the question of controlling obesity it becomes even more complicated when people blame. For example, a man can blame his spouse, you are not taking care of your body, you are overeating, you don't have willpower. Now that's a misconception because the person must be actually doing everything and still not having the results. Because of misconception, they can undergo a lot of shame, rejection, and I see the maximum stress in our region is of this type. And it is based on a misconception. The other misconceptions are, I would say, more of design, that people say, okay, you take this diet, you take that diet, and you will become okay. We know very sure that it is more than diet. Diet is important, not only for obese people, for normal people also. But diet only is not the way to lose weight. Following good dietary dietary practices is good, but we need to find out those people who will not respond because it has become a disease. So for those people, you need more than diet. That's where we come in with bariatric surgery. So these are the few misconceptions that are there.
So doctor, what are the possible factors that leads to obesity, and how stress can play a role in that?
Obesity is not because of a single cause. As I mentioned, there are multiple causes for obesity, starting with genetics. It could be hormones. It could be due to environmental changes. It could be due to psychosocial problems. So when we talk about all these things, genetics, some people, they can't do anything about it. It's just because whatever they have received as their genetic, whatever come from their parents. And then that's what results in obesity. But the environment today has changed so much, especially after, I would say, 1980s, they have seen that there is a sudden spike in obesity because of change of diet. The way people have their diet, the fast foods, the kind of material that has come out, easily people can have, instead of having their regular food from kitchen, they have it from different joints, and it's become an industry. So that has spiked into unhealthy eating habits, one thing. Less of going out into open air. Life has become very rigid, indoors, in artificial atmospheres instead of sunlight and even children nowadays like to play indoors. So restriction of this exercise and lifestyle, all this come under the environmental factors that can cause obesity, and it's very much seen in a place like Dubai, where most of the seasons we can't go out because of the heat. So we stay indoors, play indoor games and things like that.
Mm-hmm.
Then the stress is again, people are very focused. They want to earn more when they are very young. So the stress of life and the work pressures, job issues, irregular eating habits and sleeping habits, all of them disturb our inner hormonal level, especially hormone called cortisol. So cortisol hormones once it is high in the body because of stress, it leads to eating nutrient dense or calorie dense, especially high sugars, quick, fast foods and irregular eating habits. So stress can lead to faulty eating habits. It can also lead to sleep disturbances. Sleep cycle is a very important cycle for us to maintain normal metabolism. When that gets affected, people now sleep at 12, 1, 2 and get up very late. Their whole sleep cycle has been disturbed. So when you put all these things together, we have today's greater pandemic than corona actually. Today the ABCD pandemic, that is the adiposity based chronic diseases, have become and you mentioned in the beginning, it almost affects 2/3 of the population nowadays.
So doctor, can you share with us some of your patient experience and outcomes with bariatric surgery?
Sure. First of all, I must say that I'm so, I would say, privileged and blessed to see patients transform. I call it transformative surgery, and I am a transforming surgeon. That's the way I see myself, because people with obesity, with all their baggage, other than the body image, they have illnesses, diabetes, blood pressure, not having children, that is because of polycystic ovarian disease. All of them, I told you, it's a adiposity based chronic disorder, but affects all the systems. So people come with all these things, and when you are treating the root cause through the form of bariatric surgery, all these things improve. The first and foremost is they have stunning body image transformation. So when they look at themselves in the mirror, they say, "Doctor, I'm feeling so free, I'm feeling so confident, I'm wearing clothes that fit me, and I'm being accepted in the society, in my job, I'm getting promotion, I'm getting opportunities to present papers." So that is a most felt thing. Second thing is about family life. They feel that they are very much accepted by their husbands, wives, whatever, their family life, children, and the ability to help them out. Previously, they were like, a sore thumb in the middle of everything. Then the metabolic changes that result in, after bariatric surgery, from the 5th day onwards, their blood sugars normalize without medication. 5th day. Yeah. They have not lost weight yet so much, but they start seeing changes. Their blood pressure medications come off. The snoring in the night, sleep apnea, cures by itself. And then they find suddenly, people are not pregnant for 15 years. They say, "Doctor, I am pregnant now." So we tell them, please don't plan a pregnancy for 1.5 years, because your body is losing weight for the first 1.5 years, 18 months. Plan the pregnancy only after 1.5 years. So having seen hundreds of patients, go through this transformation, I'm so excited, and I see somebody who is suffering with obesity. I say, I wish that person would decide for the right thing, because that is the way to go, because diet and exercise don't work after a certain limit.
Okay, doctor, what is bariatric surgery? It's interesting to know, and also if it's harmful or good for people they are considering to go for it.
Bariatric surgery is a kind of surgery where doctors do a certain changes with the digestive system, which results in the good metabolic change in the body. This is to put it very simply. Why I said that is because it is not removing fat from the body like liposuction or abdominoplasty, which are cosmetic surgeries where fat is removed. Here we are working on how body is digesting food. And either you restrict the food intake, or you change the what we call as anatomy of the organs such a way that the good hormones are produced, hunger hormones are reduced, and a whole lot of changes takes place because of those intelligent way of changing the anatomy of the gastrointestinal tract. So regarding whether it is harmful or not, remember, surgery is not something that we do for everybody. We do surgeries on patients who need it. That's why we take up 17 years of training, because we need to know who needs what. We don't operate on everybody. It is not a cosmetic surgery to be offered. Doctor, I want to improve my body image, do surgery. No, it is a treatment for a disease. So bariatric surgery is given as a treatment solution for disease. So definitely it is good. It is never offered as a fix for something that people ask. So when it is practiced in that careful way, it is the best result. Not only it is good, it is a life-saving procedure for certain people. But what you're asking is because of some things that did not go well or it is not practiced in the right way, then people can have some bad experiences. But that is not the intent, or that is not how it is designed for. It is because of mistakes either from the doctor or from the patient. But as far as bariatric surgery is concerned, it is even safer than a gallbladder operation.
So doctor, related to patients after bariatric surgery, do they have any challenges like in weight management and nutrition or no?
After bariatric surgery, we take over guidance for the first 1 month as a surgeon. So they are given strict orders what they have to take on the first week, second week, third week and fourth week. So there's a graded way of how they are given the food, what all food. And so I give them a certain, handouts or through WhatsApp. So during that time, they all follow that. The challenges during that time is, just after surgery, there can be few complications. So we are always looking out for that excessive vomiting or, patients having any pain, those sort of things, which is normal for all surgeries. As far as food is concerned, their challenge for the first 2 weeks is they are only taking liquids.
Okay.
So some people find it difficult. Yeah. Some people are already prepared because they know from other patients that first 2 weeks I cannot have food, I'll be having only liquids. But after 1 month, they are already ready for taking regular diets. But the problem is they can't eat like before. They can eat only maybe 1/4 or less than that in one portion. So that adjustment is something that we have to encourage them to say that is enough for you. In fact, some people find it very normal because they don't have any issues of reducing that because they're losing their weight. So after 1 month, because of the normal diet, they are able to eat everything others are eating, but smaller quantities. The problem comes when they are along with other people who are having a party or having more food. Then they find they are not able to enjoy like them. So some psychological adjustments are also seen in these things. Due to the bariatric surgery, they have to be careful about their nutrition and all the micronutrients, because since they're eating smaller quantities, they have to choose that they eat the right nutrients and not avoid them, because if they stick to certain type of food, they may not get a well-balanced diet. They may be deficient in especially vitamin D, vitamin B1, B12 deficiency. These are result of improper intake and also because of improper absorption, because of changed absorption in the body. So that is why they need to be in close follow-up. So first 3 months close follow-up, then we check their nutrients, their blood levels of the vitamins. If they have any deficiencies, we treat them. There are different types of surgeries. In a surgery called sleeve gastrectomy, the nutrient deficiency is not so much as seen in bypass surgery. So in any case, we tell all of them to be on the lookout for deficiency and to be on supplements, and bypass patients lifelong.
So as you mentioned, doctor, like about the vitamin deficiencies that patients after bariatric surgery suffer from, can you know exactly what kind of vitamins usually they are deficient of?
Yes. So bariatric surgery is not just one surgery. There are different types of bariatric surgery. Some bariatric surgeries cause more vitamin deficiencies than some. For example, let's talk about sleeve gastrectomy, where only the stomach is reduced in size and we remove the extra part of the stomach. So in this, absorption is all same, but vitamin B12 absorption, because of the lack of a factor called intrinsic factor, because the part of the stomach that is reduced, can result in a vitamin B12 deficiency. Okay, and sometimes if patient is having excessive vomiting, not taking things properly, they can have vitamin B1 deficiency. Okay, whereas when you come to bypass, it can be a multiple, nutrient deficiencies. It could be iron deficiency, vitamin B1, B12, B6, vitamin D, folic acid, And of course, calcium deficiency because of parathormone, changes. So it's a multitude of changes that happens when you do a bypass operation, which actually affects the difference in absorption of the food. So we cannot predict which person will have which deficiency unless we do a personalized blood vitamin level test. And that is how we follow after bariatric surgery. We do the testing, find out the specific deficiencies, and we treat the deficiencies. And some people, in spite of the surgery, because of the balanced diet, they don't need any supplements, because they always have done 2-3 times. All the time, their vitamin levels are okay. So it is so different from different people. Depends upon the operation, their habits, food habits, and
the recovery.
The recovery. Yeah, mainly it is about the food habits. Yeah. And of course, some people are good on supplements. Some people even they buy supplements, they don't take them. So we have all sorts of combinations.
So, doctor, I'd like to explore what do you think the future of obesity treatments and bariatric surgery?
The future looks very interesting and exciting because one thing is different patients with obesity at different grades, 1, 2, and 3, need different treatments. But overall, we see what is the least necessary, not to over-treat. For example, a person who is having 31 BMI needs one kind of treatment. Person who's having 40 BMI needs another kind of treatment. However, the trend is towards going for minimally invasive or non-invasive bariatric surgery as far as the surgical treatment is concerned. And nowadays, we are coming up with certain procedures where they can do the surgery through an endoscope instead of making the holes, endoscopic situation. And there's a magnetic bariatric surgery where instead of using complicated staples, it is by using magnets, which is becoming recent. These are all interesting things that are coming up, all aimed at reducing the invasion, reducing complications as a surgery. Of course, we have already seen the rise of injections and tablets, medications to reduce obesity, like things which we have seen, Ozempic and Mounjaro. So this is becoming common, but they are not without side effects, and they are good as long as you take them. Mm-hmm. And they have found that even within 1 to 2 months or maximum 3 months, they are reversing all the good effects they are losing if they stop the medication. And they are expensive medications. So it is good for many people, but it is not sustainable. Mm-hmm. Now, with more of genetic research and microbiome is the study of bacteria in our intestines. Nowadays, that has become a focus of attention because they say that microbiome, which is a bacteria in the stomach, is very much influential to our metabolic health. And bariatric surgery, because the change in the anatomy changes the microbiome, and the good results are because of the change in the microbiome. This is again an interesting field. So, personalized genetic studies may lead to personalized medical care. So, we will be able to come up with some kind of algorithm which patient will benefit best from which kind of intervention. 1, 2, 3, 4, all those things. Yeah, you must have heard about balloons that are temporary, this. So, we have a whole lot of things going on, but focus is how we can give the best result, long-lasting results with minimal invasion and minimal complications. So that is the trend that you're going. So whatever happens, we have to see.
Thank you, Doctor, for your time today and sharing these valuable insights with us. For those who want to consult Dr. James, they can find him at Medcare Royal Hospital at Al Qusais. And also, if you have any other questions, you can just write it down and we will answer it in the comments. Thank you for watching PicPax Podcast and see you in next episode.